First of all, the economics of preventing an outbreak are compelling, very compelling. It's very affordable, these testing protocols, compared to the numbers that I'm hearing. If you get a real outbreak of a significant percentage of residents and you get a high mortality rate, which we know the mortality rates can be up to 25% or higher. And so from that perspective, we've taken the stance that we just have to make it happen because it's far better. The math comes out far better if we prevent an outbreak than we have an outbreak.
Yeah, I completely agree with what he said. I mean, at the end of the day, there's no price that you can put on preventing an outbreak. There just isn't. And I understand that the reality of emergency, the reality of doing business is that you have to be able to keep your doors open. But a single outbreak in a community is absolutely catastrophic, both from a financial perspective, but more importantly from a loss of life perspective. And as we continue to move forward and see COVID that is expanding within the states, and I think especially moving forward even a couple of months, looking into a new school year where we're going to have an incredible change in our staffing availability if students are unable to go back to school. And there are so many different factors today that impact us financially that we have very little control over. This gives us an opportunity to have some control. And even if that means that we are expanding our expenses to pay for service testing, to pay for surveillance testing, to pay for just the standard PPE operating as if you are COVID positive, those are all, yes, they're expensive up front. None of us can deny that, but none of that is as expensive as either having an outbreak or goodness forbid, losing a life. Our residents need their families. Our residents need to be able to see their loved ones. Being able to understand that is a key factor in why someone might choose to live in a senior living community, is the ability to make those choices for themselves, good or bad. And that includes seeing their family. And I think the reality is either we can figure out a way to have them safely visit their family on site, or they're going to leave and go to their family's home to conduct that visit. And if you know that that's the reality, then it's our job as an industry to find a safe way to visit and allow that socialization and that interaction, because it's critical to our residents' health that they have that socialization and interaction with their loved ones.
I agree with that. I mean, we've seen far more move outs significantly far more from just limited restrictions that families and residents just don't want to have this phase of their life without their family. They choose to move out. So having all these different testing things, and certainly if we can show that our community is COVID free, it gives everybody, gives the family more feel better. It just allows us to be more impactful.
I can tell you from practical experience that if you get an outbreak, you will wish you had spared no cost on the testing expenses. It is just takes a toll on an organization, whether you're one facility or multi-facility organization. It impacts people physically, emotionally, and it is a very hard process. And again, I'm just going to reiterate, I would do everything you can to invest in this testing. It is better than the alternative.